My friends, I'm a doctor who has spent many years studying and treating diabetes. And here's something that always worries me. Most people only find out they have diabetes when the complications already show up. Blurred vision, heart problems, or kidney issues. But the truth is, our body sends out signals much earlier. Constant thirst, waking up at night to urinate, feeling tired for no clear reason. The question is, are you listening to those signals in time? In this video, I'm going to walk you through those silent but dangerous signs, with real patient stories and simple explanations backed by science. Stay with me till the end, because knowing these signs early could protect not just you, but also your loved ones from serious complications. And don't forget to hit that subscribe button, so you won't miss the upcoming videos where I'll keep sharing practical, easy-to-follow health knowledge. Sometimes, just one small piece of information can change your whole life. My friends, over the years, I've seen so many patients over 50 come into my clinic with what they thought were just small complaints. They would say things like, "Doctor, I don't know why I'm so thirsty these days. I wake up several times at night to pee, and yet I still wake up exhausted in the morning." Some would tell me my vision comes and goes, sometimes clear, sometimes blurry. I can't tell if it's just age or something else. Others were worried because they were losing weight, even though they were eating normally, sometimes even more than before. I want you to ask yourself, have you ever experienced anything like this? One of my patients, James, 67 years old, thought it was simply getting old. But when we checked, his blood sugar was very high. What seemed harmless, tingling in his feet, a small wound that wouldn't heal, itchy dry skin, constant dry mouth. These were actually silent warning signs of diabetes. For men, it can show up as erectile problems. For women, recurring yeast infections. I want you to imagine this. If for several weeks you've been feeling unusually thirsty, your vision comes and goes, you feel tired all the time, or you notice 2 or 3 of these signs together, don't ignore them. Science is clear. Catching diabetes early and controlling blood sugar can prevent dangerous complications like heart disease, kidney failure, or even blindness. You might think, maybe I'm just overreacting. But trust me, the body always gives us signals before it's too late. Our job is to listen and to see a doctor when those signals show up. My friends, many people believe that changes in the body as we get older are simply just aging. But the truth is, there are subtle signals the body is sending us. And if we understand the science behind them, we'll see they are early warnings of diabetes. I want you to imagine this. You wake up several times at night to pee, your throat dry, craving water. What's happening? When blood sugar is too high, the kidneys are forced to flush it out through urine, pulling water with it, leaving your body off balance. One of my patients once told me, "Doctor, I drank a whole bottle of water, and I was still unbearably thirsty." And what about blurred vision? High blood sugar makes the lens of the eye swell, so your sight comes and goes. Sometimes clear, sometimes like a fog passing through. This is very different from cataracts, which blur vision steadily over time. Have you ever felt tired even after a full night's sleep, or lost weight without meaning to? When insulin isn't working well, your cells are starving for energy. The body breaks down muscle and fat to compensate, while calories are also lost through urine. I've seen many patients frustrated by a small wound on their foot that wouldn't heal for weeks. High blood sugar weakens the immune system, creating a perfect environment for infections. That's why foot ulcers can linger and sometimes lead to severe complications. And what's even more dangerous, when blood sugar stays high for years, nerves begin to suffer. Patients may feel tingling, burning pain in their feet, digestive problems, or dizziness when standing up. This is diabetic neuropathy, one of the most common yet often overlooked complications. Diabetes also quietly accelerates atherosclerosis, putting pressure on the heart and blood vessels. Some people only notice when walking a short distance causes calf pain, or when exertion brings on chest pain and shortness of breath. You see, every symptom has a scientific reason behind it. Nothing happens by chance. And if we learn to listen, to understand these mechanisms, we can detect DIAB. My friends, sometimes the body doesn't just whisper, it rings the alarm bell. I want you to imagine this. One evening, you or a loved one suddenly feel an unbearable thirst, no matter how much water you drink. Along with it comes confusion, slow responses, even seizures, rapid breathing, stomach pain, and nausea. These are no longer ordinary signs. This is an emergency. One of my patients, Linda, 69 years old, was rushed to the hospital by her daughter when she became drowsy, her skin dry, her eyes sunken. Her blood sugar at home measured over 500 mmol DL. If she had arrived any later, she could have slipped into a diabetic coma. And sadly, I've seen many cases like this. The common thread is always the same. They thought they were just a little tired and it would pass. And there are other red flags you must not ignore. Sudden chest pain, weakness on one side of the body, a drooping face or slurred speech. These may signal heart disease or stroke, conditions diabetes accelerates quietly in the background. Science shows us these events can happen very quickly, but the body always tries to warn us. The question is, do we recognize those warnings and act in time? That's why I urge you, never delay when these signs appear. Call for help immediately, because every minute counts, and sometimes, your quick action today can save a life tomorrow. You know, one of the biggest challenges in recognizing diabetes in older adults is how easily its signs can be mistaken for something else. I remember a patient, Robert, 74 years old. He complained, "Doctor, I get up 3 or 4 times every night to use the bathroom. Must be my prostate." But when we checked, his blood sugar was far above normal. In truth, frequent urination can have many causes: an enlarged prostate, diuretics, sleep apnea. But when it comes with constant thirst, blurred vision, and weight loss, that's the classic picture of diabetes. Blurred vision can also fool us. Cataracts cause vision to fade steadily and consistently. But with diabetes, vision changes come and go. Clear in the morning, cloudy after meals. Many people dismiss this as just getting old and miss the chance to detect diabetes early. Ongoing fatigue is another trap. It might be anemia, thyroid issues, depression, or sleep disorders. But when that fatigue comes hand in hand with thirst, frequent urination, or wounds that heal slowly, we have to consider diabetes as the underlying cause. So let me ask you, have you ever blamed these signs on aging without thinking of diabetes? Recognizing the difference is the key. Age alone doesn't mean we must accept exhaustion, dry mouth, or blurry vision as normal. Sometimes a simple blood sugar test can reveal the truth and give us the clarity we need. My friends, whenever we talk about diabetes after age 50, I'm often asked, "Doctor, who's most at risk?" And the answer isn't just about age. I want you to picture this. 2 people, both 60 years old. One maintains a steady weight, exercises regularly, and eats a balanced diet. The other is inactive, carries extra belly fat, and loves sweets and fast food. Same age, but very different risks. Science has shown us the factors that push risk higher. Being overweight, especially belly fat, acts like a small factory producing insulin resistance. High blood pressure and abnormal cholesterol often come along for the ride, forming a dangerous trio for the heart. I once had a patient, a woman who wasn't very heavy, but 3 of her siblings also had diabetes. Genetics, too, is a piece of the puzzle. Women with a history of gestational diabetes, people with fatty liver, or those with sleep apnea are also in the high-risk group. Even certain medications, like steroids or some psychiatric drugs, can raise blood sugar levels. So I want you to ask yourself, where do I stand in this picture? Knowing your risk isn't about fear, it's about being proactive. Because once you recognize it, you can make changes, a 20-minute walk each day, cutting back on refined sugar, or scheduling regular checkups. Sometimes, the choices you make today will shape your health for the next 10 years. You know, recognizing your risk is just the beginning. What truly matters is what we do next. I often tell my patients, the body is like a house. If you hear the wood creaking, don't wait until the roof collapses to fix it. The first step is to observe yourself. For a week or 2, jot down anything unusual: excessive thirst, frequent nighttime urination, constant fatigue, or tingling in the feet. If you have a glucometer, try checking your fasting sugar or after meals. Those numbers, combined with your symptoms, will give your doctor a clearer picture. I remember a patient named David in his 60s who checked his feet every night before bed. One evening he noticed a small scratch, and because he caught it early, he avoided a serious foot ulcer. That simple habit of daily care can prevent major complications. When you go for a checkup, your doctor won't just measure blood sugar. They'll look at cholesterol, kidney function, eye health, dental health, even the condition of your feet. It may sound like a lot, but trust me, these are the shields that protect you from the silent complications of diabetes. And never forget, small lifestyle changes can make a huge difference. Eat dinner earlier and lighter, take a short walk after meals, sleep well, drink enough water. These aren't just tips, they're the foundation for keeping blood sugar steady. So let me ask you, if you start today, what will your life look like 6 months from now? Diabetes is not the end of the road. It's a reminder to live with intention, to care for body, mind, and spirit more fully. My friends, when people hear the word diabetes, they often think only of medication. But the truth is, there are many things we can do today to ease the symptoms, without a single pill. I want you to imagine this. At night, instead of eating a heavy late dinner, you choose something light and eat a little earlier. The next morning your body feels lighter, your blood sugar steadier, and your sleep more peaceful. One of my patients, Michael, used to eat late dinners full of starch and sugary drinks. He often told me, "Doctor, every night I get up to use the bathroom several times. I can't sleep well at all." After changing his habits, eating on time, prioritizing vegetables, lean protein, and a little healthy fat, he came back to me and said, "In just a few weeks, I felt like a different person." Small changes, done consistently, can become the foundation of a new life. And exercise is another natural medicine. Just a 10-15-minute walk after a meal can lower blood sugar in a safe, effective way. Science shows our muscles are the most powerful machines for using up glucose. And of course, getting enough sleep and cutting back on coffee or tea after 2 p.m. can help you avoid those restless nights when your bladder keeps waking you up. Even small infections, gum problems, skin irritation, or urinary tract issues can make blood sugar spike. Treating them early not only makes you feel better, but also helps keep your glucose levels steady. So I want you to ask yourself, what small step could I start with tonight? Because sometimes the real power doesn't come from big, dramatic changes, but from the simple habits we repeat every day. And those small choices are what quietly protect us from complications, giving us back our freedom in life. My friends, sometimes we don't have to wait until a doctor's visit to realize something is wrong. Just 1 minute is enough to check in with your own health at home. Imagine this. Over the past 4 weeks, has your body been sending you any signals? Do you often wake up more than twice a night to use the bathroom? Do you feel a dry mouth, constant thirst, or vision that comes and goes? I once met a patient, Susan, who thought her constant fatigue and gradual weight loss were just part of aging. But as we talked more, she admitted her feet often felt burning and a small scratch on her skin hadn't healed for weeks. What seemed like small details were actually important pieces of her health puzzle. Ask yourself, have you noticed itchy or darker skin patches around the neck or underarms? Have you had minor infections that keep coming back? Or maybe, one time at home, you checked your blood sugar and it was unusually high. When you put these signals together, they can clearly point to the need for a checkup. If you notice 2 or 3 of these signs, don't wait. Be proactive and schedule a health exam. The earlier we detect changes, the better we can manage them, and the more freedom we'll have to live a healthy, active life in the years ahead. Let me emphasize this. Just 1 minute of listening to your body today can change your entire health journey tomorrow. So, are you ready to give yourself that 60 seconds right now? Hi friends, health is a lifelong journey, and every small step you take today shapes the quality of your life tomorrow. If you found the insights in this video helpful, let them be a gentle reminder that our bodies always deserve to be heard and cared for. I truly believe that with early attention, you can live healthier, feel happier, and enjoy every moment with your loved ones. And don't forget, I'll be back with more videos, real patient stories, and practical science-based tips to walk alongside you on this journey. So make sure to hit that subscribe button, and together we'll keep building a healthier, fuller life.